Okay, so quick introductions today, since we have a little bit less time together. I'm going to go ahead and introduce myself and ask my BBF team to do the same, and then we'll ask folks to introduce themselves in the chat. My name is Anna Brulette, and I'm BBF's Policy and Program Director. I support the COAT team with some facilitation and agenda development, and have gotten the chance to work with and meet many of you in that capacity. And I'm going to have first probably Beth introduce herself, and then Morgan and Dora, who are joining us today to talk a little bit about a recent CIS data project, who introduce themselves as well.
Good morning, Beth Trzanski, Deputy Director of BBF.
Morgan, are you in a spot where you can introduce yourself?
Sure. Good morning, all. I'm the Executive Director at Building Bright Futures, so it's good to see all of you. And I also hold a faculty appointment at UVM in the College of Education, and just newly this last month at CDCI, the Center for Disability and Community Inclusion.
Good morning, everyone. Nice to be with all of you. Thanks for joining. I'm Dora Levinson. I am the Data and Research Director at Building Bright Futures.
Awesome. Thank you all. So again, for the sake of time today, I'd ask folks to just introduce themselves in the chat. That would be great. Name, role, and kind of where you sit within early childhood work. And as for today's agenda, we just did intros. We're going to do a quick, a little discussion about ACT Early and our work on that grant, as well as ask folks to take a brief poll related to that work. And then the bulk of our time, as I said, is really going to be kind of hearing from Dora and Morgan about this recent work with the CIS state team. And we'll finish, if we have time, with some brief updates and announcements. So jumping right in, we can skip this for now, Dora. Thank you. So as folks on this team know, the COAT team has really kind of been our primary advisory body that has helped the BBF team and the maternal child health team as we've undergone this work with the ACT Early COVID-19 response grant through AUCD. We're just wrapping up that second year of work. And thanks to all of your work and all of the work of the BBF regional team in particular, we've really been able to promote resilience and learn the signs of ACT Early tools throughout the BBF network, as well as really focus on this piece around increasing the number of early childhood educators and healthcare providers that are trained on the ASQ online, and other tools that are really promoting early intervention and screening. So we're really proud of this work. I'm trying to see if Janet has joined us, because I'd love to give her an opportunity to speak to this work briefly, but I don't think she has. But certainly could not have done this work without the support of her and her team and the Help Me Grow team. So with that being said, we are going to ask folks to do a brief poll that we did back in October as well, that's really kind of focused on how COAT does in facilitating some of those key connections that the ACT Early work, as well as other pieces of work, namely the VIP3 grant, which this group is also a kind of a key player in, how well COAT is doing in facilitating some of those connections across sectors within the early childhood space. But I will pause briefly and see if anybody has any questions before I launch that poll about ACT Early or any of that work. Yes, Renee.
Good morning. Apologize if I've totally missed this. I did join a few minutes late. I'm just wondering about the final report for ACT Early. Like when I see that second bullet there and increase the number of early educators piece, I'm thinking like, did we do that? Like what was our baseline and where did we start? Like I know that the activity is really more about this group and whether or not it was able to facilitate those connections and that charge, but I just wonder if there'll be future opportunities to hear more specifically about the the summary work of AUCD and kind of where we started and where we ended?
That's a great question. We are just kind of finalizing our final annual reporting and Q4 reporting for that body of work. But if that's something that folks are interested in, I don't see why we couldn't share some of that reporting or do, a follow-up part of a presentation at a future COAT meeting, if that's something that folks are interested in kind of seeing the progression a little bit more. Morgan, I don't know if you have more thoughts on that, on sharing that
Yeah,
work.
I was just going to say, I think that work was started primarily under Act Early, but it's really a continuation, and we plan to continue to build in this area under the VIP3 project funded by HRSA. That is a very concrete primary goal of that project, is thinking about integration between early childhood education across the different sectors and health, and what does it mean. So I know Janet and Lauren have been doing so much work and really prioritizing their time in this area. But I do think it's a great idea to be able to bring some of that data and our progress here as well.
Absolutely. Thank you, Renee, for that question. All right, seeing no other hands. Oh, Janet has joined us. Janet,
This
do you
is
have
Janet.
thoughts?
Hey, and we definitely moved the needle on that, Renee. And just, I know we're preparing our Help Me Grow annual report right now. So with some of that data, but I'm happy to do a deeper dive at a future COAT team, and share some of our data specifically about who we've trained and how many. And I know that at the end of 2020, we had about 2,500 screens entered in the ASQ online system. This is from multiple providers, not just early care. And then now we are, by the end of 2021, we are over 6,000, and now we're over 9,000. So keeps growing and growing. And part of that are early care and education providers. And we also did some in-depth quality improvement training and coaching with a cohort of 9 programs. And that's really integrating the Learn the Signs materials as well as using the ASQ. But happy to do a deeper dive. So thanks for the question.
Awesome. Thank you, Janet, for that extra info. Alrighty. I'm going to move us along and ask folks, I'm going to go ahead and launch today's poll. If you joined us in October, you'll recognize this question, and recognizing too that we have some additional or new folks on the COAT team today because of the CIS data presentation, and we're so happy to have you. If you're not a regular member, there is an option to indicate that. So I'll give folks just another minute or two to complete this. All right, looks like we have everybody. Thank you very much. So we're going to move on to, actually, I'll share the results first because it's kind of cool. We can see through this that we have lots of new folks joining us today. And with that, it's a really good transition to my team, Morgan and Dora, who are going to share that CIS data work with us. So I'll pivot to you all.
Good morning, everyone. For those of you who are just joining today, this meeting is really a cool place to look at how far we've come since the October meeting, where we had a really robust discussion of how we as a state are prioritizing early identification and then equitable access to services, and all of the different partners that are coming together to make that work happen across the state of Vermont. And as most of you know, Building Bright Future's role in the system is to be monitoring service provision, to be monitoring outcomes for kids and families, and really understanding from a data-driven lens how we're doing and supporting the state in moving towards the goals we've outlined in the Vermont Early Childhood Action Plan. So one way that we were able to support the state and build capacity this year in this area was to partner with CDD and the Children's Integrated Services state team on an analysis of a very small group of participants from Children's Integrated Services. So what you're going to hear today in terms of the agenda for what we'll present in this data brief is a little bit about the background, the methods we used, the findings, the limitations, policy considerations, and then we're really going to push this group to be talking through how to use these findings, what they mean, and what resonated with all of you. Go ahead to the next slide, Anna. So in thinking about the purpose of this project, one of the things that we've heard consistently as a narrative in the state of Vermont is that there isn't data on Children's Integrated Services. And what we've found is that that's not really true. There's so much data that all of the different partners across sectors are collecting on the impact of CIS for families. And so one of the first projects that we proposed in supporting CDD and CIS in analyzing that data was very specifically to analyze qualitatively families' experiences with CIS. And this is for a subset of families who completed the early intervention family survey between November 1st, 2020 and June 30th, 2021. So again, not a complete evaluation of the CIS program and this beautiful look at the impact of this entire program on all of the different families. There's definitely further information we need to capture and analyze to get to that. But it's a really amazing look at families' experiences for those who participated in early intervention services as part of this broader system. And I love seeing that, Jen. So those are Jen's babies on the slide. So in terms of the project design, the questions we posed to frame the work were the 4 in the bullets right there. What are families' perceptions of the impact of CIS on their child or their family? What were their perceptions of which components were most critical or impactful to their family? What were their perceptions of the major challenges and barriers that they face? And what were their perceptions of opportunities to improve this program? Next slide, please. So as Dora and I were approaching this analysis, we decided to use a very formal qualitative approach to analyzing this data. It's called the framework approach, and it involves multiple steps and really rigorous nature of moving from familiarizing ourselves with the data all the way to summarizing and interpreting. So over the course of the project, we'd review and continue to look at what themes were emerging, developing a coding index, and then actually going through and coding the data separately and coming together to say, okay, is this what we're hearing? Yes. How does this map to what we know about the program? And then summarizing and interpreting that data. So really excited about being able to bring some formal research training into how we're thinking about data analysis in Vermont. And before we go on to what we found in this, I think it's also really important to know a couple of other things that we did in terms of comparative review. So we have reviewed most of the documentation that's come from CIS over the course of the last 5 years, any reports, presentations that have been given, and anything that, again, is publicly available to make sure that we really understand the goals, the purpose. And we've also met on multiple occasions with the CIS and CDD team to understand from their perspective what data we actually are seeing and what things we should consider as we're thinking through this analysis. And so a couple of notes before we go into the findings are that we are still working on the final language for some of this with the CIS team. And we really took an independent lens to how we were interpreting this data. So some of the terms might not be the exact terms that you've heard from CIS over the past few years. And so we're still working through some of those things, but really looking at this from an independent research lens. So I'm going to transition to Dora to tell you what we found in this analysis.
Thanks, Morgan. So through this analysis, we were able to pull out 3 major themes with a couple of sub-themes within each of those questions and that we had posed with for the project. The first theme was around families' perceptions of the impact of CIS. And the first theme that was really, that came through so strongly was the positive and helpful experience that families had. Again, that these were families who had received early intervention for at least 6 months. And this was self-reported, how the question was, we would like to hear about your experience receiving CIS services overall. That was the question that we had access to, and all qualitative information, so rich, thinking about how families described their experience and what we were able to pull out of there. So again, a hugely positive and helpful experience, serving as a resource that families were able to access appropriate services and that they were met where they were. Another sub-theme about the impact was around the child's developmental progress. And we saw a lot of families say that their child wouldn't have made this progress without the program, that they came in significantly behind and really had made this huge jump in multiple domains. We specifically heard about motor and speech and language, and there were a lot of people who just said developmental progress. And because we didn't have access to the full survey, we weren't able to cross-reference which domain they had received services around. But those two, speech and language and motor, really came through, that people were talking about those. But we don't know if they're around social emotional or any of the other domains. The last sub-theme here was around parental and family competence. And this is a big goal of early intervention, which is really supporting families to be able to support their children, their child develop and learn. So families talked about knowing their rights and being able to advocate for their child, that they had a better understanding of their child's strengths and abilities. So really that there was a lot of growth in that bucket as well. The second theme was about families' perceptions of the most critical components that led to this impact. And the first was around care coordination. So again, that families, we hear so often about the complexity of Vermont's early childhood system and the difficulty navigating that system. So the care coordination element of children's integrated services and early intervention was so critical in being able to access those services, being able to have a point person, consistent and reliable communication, making connections between key providers, that wasn't landing on the family, that there was someone else that was taking care of and holding that so that they could focus on learning about their child's strengths and abilities. The other sub-theme here was about the CIS workforce, that these interpersonal interactions and relationships made all the difference. Some of the words that came through were kind, helpful, patient, caring, understanding, empathetic, resourceful, and supportive. That the communication was reliable and consistent, that there were appropriate expectations set, and really that the staff were knowledgeable and highly qualified, that there was a confidence that families had in the staff for being able to guide in this vulnerable position that families are coming into the system with. The last theme was around barriers and challenges that families experienced. And while I don't want to diminish any of these, I do want to note that there was a much lower prevalence of respondents who talked about barriers and challenges compared to the impact and the two themes above. There were 3 sub-themes that came through around challenges. The largest was around the pandemic and the transition to telehealth. And when we think about some of those critical components about interpersonal relationships and interactions, that those aren't the same as we transition to a telehealth platform, that there is something really important about being in person to develop that relationship, that it's difficult to model over a video how to how to interact with a child, how to model that, those ways that parents could help their child develop and learn. I think that it also came through that the CIS workforce did a really good job of adapting, and it was still a barrier. Both care coordination and the CIS workforce were above as critical components of a positive experience, but that they were also referenced as challenges around when they weren't meeting their potential. So when there was inconsistent communication and that scheduling was a challenge and the coordination was missing, that was clearly not meeting the need of families and respondents. And then additionally, a self-reported that that the workforce was not engaged, that there were high caseloads and frequent staff turnover that really detracted from the program and experience. Like all data, there were limitations in this analysis. And not to detract from the findings, but it is really important to think about how generalizable the findings are and what this means moving forward. So first of all, this was a subsample of CIS. So it was only families who had received early intervention for at least 6 months. Those were the only families who received the survey. So if there was a family who had received early childhood and family mental health, but hadn't received early intervention, they did not receive this survey. So we had originally in our project design, we had wanted to talk about CIS broadly. And so that clearly is a limitation if we're only talking about some of the families who had received CIS services. Additionally, there was a 61% response rate out of that subsample. And we don't know why. We don't know why families responded or didn't respond. And again, thinking about the generalizability of these findings, because of that response rate, we don't know whether we skewed towards the positive or towards the negative. We don't have that information. Because of the data sharing agreement, there was a singular question. So it was only that question about hearing about your experience receiving CIS services overall. And we weren't able to look at, for example, the domains that children were receiving developmental support with. One of the most important ways of being able to share qualitative data is through quotes and looking at the prevalence of themes. And because of the data sharing agreement, we weren't able to do that and won't be able to share that within the final brief. And I think that we have been able to paraphrase a lot of what was coming through from families. This next one is really interesting and something that we've been exploring with the CIS state team is the way that respondents talked about they talked about services as CIS or as early intervention, or sometimes CIS at the beginning of the response and early intervention at the end. And it was unclear which program they were talking about, if there was a broad understanding of the differences in the program, and not saying that's good or bad, but that it was very clear that there was this interchangeable use and something to be explored further. And then, of course, more COVID-19 pandemic analysis, limitations, thinking about the barriers and challenges were so related to the pandemic and telehealth that there may have been other barriers that did not rise to that level, that the service provision had clearly changed. And when we think about the CIS program that has existed for 10 plus years, we're not able to take this information and generalize throughout that program time. So I'm going to pass it back to Morgan to talk a little bit about the program and policy considerations that came out of these findings and the limitations.
So as we're thinking about policy and program considerations, we've had time to speak with the CIS state team and CDD more broadly about this, and it's a really interesting place to be, where our team and that team has such extensive experience around what we know to be true and what's working and what's not working. And it's really important that, related to this data brief, that we are only presenting policy considerations that were directly coming from the data or the limitations in this data. So I think that what we all know to be true is there's so much opportunity for moving forward with data analysis and the work of CIS, and just wanting to be clear that we tried to hold very true to what we heard from either the data or the limitations from the data around these policy considerations. So the first is valuing care coordination. And this one is still very interesting. And we're working with the CIS state team on the language here, because we recognize that service coordination is the term that's most often used in Vermont related to CIS. And what we felt when we were analyzing this data is that care coordination or service coordination is really coming through as one of the most critical components of the work for families and their experience in supporting this idea of seamless navigation. And so that's one thing we really tried to think through. What does that mean for service provision and what we need to prioritize in the state of Vermont? We also were trying to pull from what we know about care coordination as a key feature in other national best practice models, specifically those that have already been adopted in Vermont, and try to think about those relationships like Head Start and Early Head Start, Blueprint for Health, and the Dulce model. I think this one's also really important to think through, because what we've heard is that care coordination and this service coordination, or the team time that's necessary to think through and have a critical strategy for service coordination, is what's costing a lot of money in the state of Vermont, right? So the total cost, or the proportion of the total cost around how we think about service delivery in CIS, care coordination is a significant part of that. And that is what families are reflecting back to us as a really important part of their experience. I also want folks to be thinking through the fact that case management, specifically case management, is billable as part of the CIS system. And there are components of what we're hearing from families that might not be covered in that part of the rate. So thinking about all of the team meetings and the staff time to really support how we are wrapping around kids and families. And that's really an important piece. So one of the things for policy considerations that we're putting forward is how Vermont should be prioritizing and investing in this model of care coordination as a critical component of service delivery for families. And again, still working with the CIS team to think through what is the right language to be using there. So we'll continue that discussion. The second is around the workforce. So again, the first valuing care coordination really came through in the data from families. The same thing's true for investing in the CIS workforce. What we know is that care coordination and the individuals who are working with families are the two most critical aspects of service delivery, specifically for families who participated in early intervention during this time frame. And so how can we think about building the capacity and the experience and expertise in this arena? And I want I want to bring in the fact that this has been on the forefront of the State Advisory Council's recommendations for the last 2 years, is really thinking about how we're investing in the early childhood workforce. So we can send those recommendations, but I want this group to primarily be thinking about how we move on some of these recommendations in the next year if we haven't seen significant progress made, and what that means. And so there have been a range of strategies that have been identified to support the early childhood workforce around compensation, sign-on and retention bonuses, relocation costs, housing stipends, additional benefits and financial support. So really wanting folks to be thinking critically about what it means to invest in CIS as a workforce. The next 2 areas are really coming through from the limitations in the data. So again, holding true to the brief, there are things that are coming through from families, but there are also some major considerations around the data and the limitations that we have. So one primary area that we want folks to be considering and prioritizing moving forward is a full analysis of CIS, a full examination of what's working, what are the challenges, and working through a continuous quality improvement model. So again, this analysis was on a very small subsample of those participants. And we were so incredibly excited to hear that the CIS state team is already operating in this model of continuous quality improvement and following up with families who had challenging experiences and really working to meet those needs. And in order to continue to do that work really well, we need a full evaluation of the program, which includes expanding this family survey to capture information from all of the families experiencing and participating in CIS. Considering a retrospective analysis, both qualitative and quantitative, of the last 10 years of data that we have on CIS. There's so many ways that that information is captured. And some of the major points that we want to be prioritized there are, what are the major challenges to service provision, both from a family lens, but also a provider lens? What are the factors that are most critical to supporting families and the impact it's having on the children and families? And really, again, thinking about this program both holistically, but also in terms of the discrete programmatic functions, recognizing that early intervention is one piece of this broader system, and that there are also other surveys out there that are capturing some of that data. But how can we, as a state, really think holistically about CIS and the impact that it's having? The fourth is around the data system and infrastructure. And again, this is another area that the State Advisory Council has prioritized, and we still have not seen as much progress as we would like in this area. So to do this work well in the state of Vermont, we need to invest in and sustain a CIS data system and the infrastructure. And that does not just mean having the data system. It also means prioritizing the personnel capacity and expertise that's needed. And what I would say is that without this type of data infrastructure, we aren't going to be able to do that routine assessment of the program, address the critical issues, and keep operating in that continuous quality improvement model. And so again, wanting to recognize and call attention to the fact that investing in this data system and personnel data capacity was called for by the SAC in 2020 and 2021. So as we're thinking about what recommendations we're putting in front of the State Advisory Council and how those are being used, I want you to think critically about what are the tangible components of that we can move forward and think through critically. The last is more of a programmatic feature, and this is really coming from the data that we just heard around folks describing the program as either CIS or early intervention, and really needing to have clarity and strong communication around the intent, the goals, and how we as a state are talking about CIS and some of the discrete programmatic components. And again, this is not necessarily something that would come through formally as a policy recommendation, but more for discussion that we've already started with the CIS state team to think about, how are we talking about this program, and how do we make sure that all of the partners in the system are using the same language to talk about the importance of this program and the discrete pieces. So I think we can pull down the screen share now. And, I'd love to hear folks' reflections around, what has most resonated with you in hearing about this data, what you're excited about, and any opportunities you see around moving forward with this data and making more concrete recommendations. To address one discussion that we did have that I think is important for everyone to know, in our data briefs, we are listing this section, policy and programmatic considerations, because we haven't necessarily put this data right in front of the State Advisory Council and had them endorse them as SAC recommendations. But the purpose of these data briefs is for you all to be sitting and thinking critically about this data and how we need to move the work forward and how the State Advisory Council should prioritize recommendations moving forward. So again, what we tried to do is in this policy considerations section, identify all of the times and areas where the State Advisory Council has said already, we should be doing this and that we haven't made progress in that area. So what does that mean? And how do we move? Kaya, thrilled to have you in the room as another qualitative researcher.
Okay, first of all, kudos to you and your team. That was a rigorous, elegant, and thoughtful research design. I'm so impressed with how you thought it out and how you put it together. And one of the things I've been thinking about a lot, I've been doing a lot of national level webinars on data gathering and data analysis. And if I'm going to put an equity lens on this, I think one of the things that could be really important is to disaggregate the data by region, even if we only have 5 responses. Like, this is what we're hearing from this region, and then compare regions to each other. Because I think what you got was really rich. I think it's given you or given us some good guidelines and ways to think about how families are experiencing things. I really, really love that you put the limitations and challenges in to help us think about what are areas that show we can or can't apply this data, but also where are families seeing pain points? Because I think that's where, we can really start making some change. And I will say, if you are going to end up doing a further deep dive qualitatively, I will volunteer to be a coder, because I am really, really just super impressed with what you were able to pull out.
Love to hear that feedback, Kaya. And I agree with you. One of the things, it's as a researcher, all I want is all of the data to be able to really dive in and then be able to, triangulate the data that we have between the quantitative and the qualitative and really think critically about this holistic picture. And I just want to say, I'm really excited about the partnership with the CIS state team. They've done such incredible work on the data front without the capacity, without the data system. And we have a really important opportunity to think about how to partner on this moving forward, which is really amazing. So we didn't have the opportunity within this specific data set to do that analysis, but we do have an opportunity to think critically about how we're asking questions and how we're getting high response rates, and where we have an opportunity to do that disaggregation by region, by different characteristics, by program.
I do think that your response rate, even this for surveys, a 60-some% response is awesome. So being able to pull from that is great. I would also love to think about, if we move further and you do end up doing the entire analysis, is to also have some questions, both in survey form and in qualitatively, on trauma and resilience, because I think that's an important piece, especially with COVID. And that's just me tooting the horn for what I do, but I also think it's really important.
It's great feedback. And I think, one of the things that we'll need to be thinking about going forward is, there are discrete components of service provision that happen in CIS and their CIS holistically. And how I know one of the major comments and discussions that we've had is, how do we not overburden families in terms of survey fatigue, and how are we really partnering to capture the information we need, both for, the discrete programs and federal reporting requirements, but also holistically as a program. So yes, really important. And I'd love to really hear more from folks about what you're excited about about us being able to potentially capture and what data is important to you? What's showing the impact that we haven't done a deep dive into? And again, there is so much data. There is quantitative data. This was just one very small sliver of this broader potential. So thank you. And yes, kudos to the CIS team. Cynthia.
Good morning. Thanks, Morgan. I've been mulling over sort of, the actual data infrastructure and system. And of course, I think a lot of us on this call know that Vermont has tried several times to get a true comprehensive CIS data system off the ground. And I'm just curious, with a lot of the change in state government personnel, do we have a history of why we haven't been successful? I get the idea of continuing to promote this, and absolutely it's critical. I'm totally on board with that, but we seem to not be gaining traction with actually getting the system built. And so what is it within our state agencies where we have not been able to get over that hurdle? And what can we learn about that so that we can actually develop a policy recommendation or an investment recommendation that might actually get us over the finish line? Because I feel like all I know is that we haven't been successful, but I'm not really sure why. I don't really know what's gotten in the way, because we've invested a lot of money and a lot of time. And this is so necessary for our families and for our workforce, for everybody. So I'm just curious what we can learn from state agencies or partners on what hasn't worked, and then how do we inform policy recommendations moving forward.
Yep, great point, Cynthia. I'm not going to put any of my state agency partners on the spot. You're welcome. But I do want to say, I think that there have been a range of challenges. It's not any one thing. I think that there have been significant leadership transitions. I think that there has been shifts in how we think about what should be funded by state versus federal dollars. I think that we also have had a gap in the federal dollars that have come into the state that have traditionally focused on building data systems. And I will say that my understanding currently, and I'm looking virtually at my CDD partners right now, my understanding is that there is intent to have a CIS component or a module within CDDIS in terms of a longer term vision. That being said, we have had this topic on the agenda for State Advisory Council recs, and it has been a priority of CDD and CIS. And it hasn't gotten across the finish line. I think one very concrete big challenge was around the preschool development grant. Vermont received 1 year of funding for the preschool development grant and had anticipated another 3 years of that federal funding. And when that funding didn't come through, I know that this project was a very concrete component of that work. And at the same time, we saw some significant leadership transitions. So I think that that plays a role. And again, I don't want to put any of the other state agency leaders on the spot, but if you do want to raise your hand and weigh in, feel free. Sheila.
Thanks, Morgan. I didn't raise my hand around the data system, but I did put something in the chat. I've worked for the state of Vermont for 20 years, and I've been involved in many data warehouses, data systems with internal and external components, and they have never come to fruition. So database development just within the state of Vermont is extremely challenging. I agree with what you said, Morgan. It's not just one thing. It's just, I think there was a report by the Secretary of State several years ago about the amount of money that the state as a whole has put into developing data systems that never came to fruition. And it really does define the challenges with doing that kind of work. But what I did raise my hand about was I'm wondering if in your next phase of really doing a deep dive or evaluation into CIS, if you might consider doing focus groups and or surveys to actually ask families about what is confusing about the message. Instead of us trying to figure out, let's ask them, like, what do you hear and see, and then what about that is confusing to you? Or does it help you understand this? Or what perception do you get when you see that or hear that? So really doing some focus groups with families to help them, to ask them about, what's confusing about this, because we have a different perception than they do.
Right. Yeah, it's such a great point. I really appreciate that, Sheila. And, it's something that we will continue to work with the CIS state team on, is kind of a plan for what you really want to know about CIS, what data we have that will help describe that, and what data is missing that really still needs to be collected, and how do we move through that line of inquiry, and where we can help build state capacity. Because I agree, I think that not everything can happen within state government, nor should it in some ways. I also think this idea around whether or not families need to know who and what service provision is described, it is a really interesting question. Do we want families to see the service system as this comprehensive system and seamless navigation versus understanding the discrete components of what that looks like? So I don't think there's necessarily a right answer. We want it to be seamless, and we want them to know their point people. What does that look like? And what's the right balance of what they are able to see and how we provide those services? Robin.
Hi. Sorry, let me get my video. There we go. So my comments are purely as a parent and somebody who's been kicking around early childhood, both professionally, but also as a parent who has been a consumer of CIS. Thank you, Ann Dillenbach. I'm almost going to get emotional because I don't think that I've ever heard in this ecosystem the depth and care around this conversation, and the amount of energy and time and the focal points that you have brought to light through this presentation, and really also naming excuse me, the limitations, is so validating in so many ways. And I don't think I've ever had that experience. So I just want to say thank you for this. It's tremendous work. It's really encouraging to see. And the only plug I want to really put in around the workforce investment is the equity lens, and to ensure that the recruitment and retention focus really does take into account genderqueer folks, Black, Indigenous, and other people of color, folks who have had lived experiences. It's like night and day when you can engage with people who reflect your own life. So, and it also has a cascading impact on the collaborative partnerships of CIS. So, but I just want to say hats off and thank you so much for everything that you guys are doing.
Thank you, Robin. I'm going to get emotional trying to respond. Thank you. And I hope the CIS team and everybody who's working in CIS and who is here for the first time is really taking that to heart, because we are just putting the data in front of folks in a way that's digestible. This is really about the impact this program and your teams have been having on kids and families. So congratulations to all of you. Leslie.
Hi, I just wanted to bring up one piece, because I know that we were talking about, or it was brought up, the how much information or how much of a response you were getting from families, because I know that that's always a tough piece, and maybe taking a step back as to how we can get families involved more. Like, can we look more into I don't know, like where the services are being provided or where the families are, and, community centers, that kind of thing, and really look into that, as opposed to, I know when I worked in early intervention, it was, we hand delivered surveys way back when, trying to get things and asking them to hand them back. Like, there's just so many different ways. And families are really, families are busy. Families, are sort of nervous because they don't understand what the surveys mean. Somehow we can take the time for them to really, use the information that has just been received in this short survey, this short data collection, and maybe explain to them more, not just in like a written letter, but, obviously, because we have different languages being spoken and, new Americans coming in, just so many different ways. How can we communicate the importance of this kind of survey, and how their voice is really important and how we can hear it? So maybe before we start getting way ahead of ourselves, like really go back to that family piece and look at ways that we can really get families involved, because I know that I'm seeing, even like about the AOE, we're really seeing, families becoming part of our focus and really engaging in things. So how can we carry that forward and keep that going, keep that momentum going, even in like the more smaller communities that are sort of tucked way out, not just Chittenden County, but really how do we pull those smaller communities in, and from families from smaller communities too, to get a lot of voices, to get really good data.
Thank you, Leslie. It's reminding me that I want to share that, yes, our team at BBF has helped support build capacity at CDD to put this out in a really, rigorous research way with a family-centered lens. And CDD has been doing, and CIS has been doing a really great job of analyzing a lot of this data already. And I think it's also about the communication power, letting families know that this is a mechanism by which their voices are being heard, and being able to reinforce that it's being used to improve programmatic service provision, that the legislature is using this data to inform their decision-making on funding and those pieces. And I think that the more we can talk publicly about the impact of the program, where there are challenges, and how we're working to kind of address those barriers, the better. So I think that some of this data has been out and presented to, for example, the Hillary, I'm gonna need some help, ICC.
Yeah, Vermont Interagency Coordinating Council.
Thank you. So some of this information has been out in different ways. And I think that part of the way that BBF is able to support the state in getting this out is, again, looking at it independently from a rigorous research lens, but then making it publicly available and getting people to pay attention and use the data in different and meaningful ways. And I think that will also help with folks wanting to be a part of responding and making sure their voices are heard. Go ahead, Renee.
Hillary, why don't you go ahead?
Renee, I'm glad to wait. You were first. No.
I think with your proximity here, it makes sense for you to go. Go ahead.
No, I was just, I was going to say, Leslie, thank you for your comments too. And it really sparked me to share a little bit about the CIS sort of family engagement system that we are being really intentional about. And so this survey with family feedback evolves every year. And we have been developing tools to also support the information that we reflect back to families, saying, we heard you saying X, Y, and Z. This has directly contributed to us focusing efforts and program improvement, work in certain areas to support that. And we've been, we have opportunities on the survey. There's also a checkbox for families to indicate that they would like to share more about their experience or get more involved in program improvement efforts. And that has been incredibly successful. Each year for the past 2 years that we've done that, we've had over 70 families check that box. And that leads to anything from follow-up conversations where I'm just gathering information about their experience that then we can refer back to as we do program improvement work. And it's led to the VICC, which Morgan was just chatting about, which is our primary advising and assisting body, having 5 family representatives on it this year that are really in leadership positions. And there's a co-chair of that council that's also a parent co-chair. So, we've been really, and with the ARPA funding coming through, we've been looking at ways to support regional teams also in bringing to fruition, some family engagement work that they've been thinking about. So we really want this connected system so that families know that their feedback matters, that it translates into program improvement work, and that they have a really scaffolded way to get involved in advising and assisting CIS. So it's exciting work every day. It moves forward. And we're so grateful for the partnership with BBF to continue to spread out and share in incredible ways. Dora and Morgan, that was so nicely done. The work that's happening and the experiences that families are having with CIS.
Sorry, I'll come off. Clearly we established I was going next. Yeah, I just wanted to, a couple of things. One, kudos to Hillary and all of those points that you raised about the ongoing work and how thoughtful and intentional it is. And I'm just thinking back to your closeout VICC meeting, you know, and you being able to really articulate for families, this is how we heard you, this is what we heard, and this is a direct line of how your feedback changed our process. And I think that's so meaningful and something that we should also be thinking about and borrowing. I think Jen's still on in Families and Communities Committee, right? Like we've struggled with that within that committee of, we want to mobilize a group of families and caregivers and empower them. But when we get everyone excited to do that work and we bring them together and they share their feedback and then they don't see that it goes anywhere, we're actually contributing to that parent burnout. So the efforts, Hillary, that you've done within VICC have been amazing. I know you're no longer co-chair of Families and Communities, but still that connection and an opportunity to cross-pollinate and grow those systems. You know, the other thing I just want to mention is really around this capacity issue. You know, Robin, you know, your comments, like they sit with me and it's like, I'm so happy that this information can be shared and it impacts people. And then I get slightly frustrated because we've had this data. Like the CIS team has been working, and I think about Sam and everyone who's involved in those efforts, and we've got all of this data and the hours and the woman power that's gone in to collecting it. And we haven't had the opportunity we haven't had the capacity to do this kind of public share. So for me, it also kind of sparks me and thinking about that, you know, those recommendations and what are we looking at, and roles and responsibilities, like it's my catchphrase these days. But it's great to have BBF as a partner who can help do some of this analysis and push it forward. But there's also so much more happening within the CIS state team. And to be on this call today and hear about how this little sliver of work really impacted folks on this call, I'm thinking about all the other information we have and the power behind that. And we've just been restricted in terms of our capacity to put it out. So that, in addition to that, the infrastructure around data and a data system, which is so vital because we can't really embrace care coordination till we have some IT behind it that allows us to do that. But it's much bigger than just a data system, and it really is a conversation about capacity and where that should sit. You know, my personal opinion is it's great to have BBF as a partner, but BBF also isn't able to like extract all of the stuff that we have within CIS. It's not CIS focused. So how do we also support and really advocate for increased capacity within CIS? So we're not just here sitting on all of this really great information, but we're able to share it out with partners and make more of an impact, like I think we've done today in this 1 hour call. So.
Thank you all. So I know that we shortened today's meeting. We are exactly at 10. And I just want to say I am really proud of the work that our team has been able to do in building this capacity at, CIS and CDD. We are working really closely with different departments, divisions, and our agencies to really think about how we are taking data, making it publicly available in a very digestible way, and actually getting folks to pay attention and use that to inform decision-making. So I really appreciate the time and being able to have this conversation and this follow-up with the team that we initially started this discussion with, and would really want to prompt you to be thinking about what we've outlined as policy considerations, where the State Advisory Council has made recommendations, and how to move that work forward. Coming into our next round of State Advisory Council recommendations, and how we can be building capacity with each other and partnering on these efforts more. And I think I was trying to see if there were any other updates, Anna and Dora, that we need to make sure that folks are aware of before we break.
Nothing crucial. Just we'll give folks a heads up. We will likely meet in August. We'll be giving, our hope is to have a draft of those SAC recommendations, preliminary recommendations to share with you all and to start to get some reactions and feedback on. The SAC is canceled in August for those that typically attend that. And also please be on the lookout for information about the families and communities teams work on a family needs assessment, which will be launching probably in late August. And we're currently recruiting some parent ambassadors to help us share that in their communities. So if you have folks in mind, please kind of send them our way and look out for info on that. And I also just want to recognize we didn't have time today for partner updates and announcements. So if you have anything you'd like to share with this group, please feel free to send that to me and I'll get it out with the notes. So thank you all so much for joining. It was good to see folks. Take care.
Thanks, everyone.
Bye.
Thanks all.